Hello and welcome to the 3 key components for moms breastfeeding babies with colic, reflux, eczema, and food allergies workshop. My name is Dr. Beata and I'm a holistic and integrative doctor of physical therapy. And I empower moms to find peace in their souls, learn to trust their hearts, and heal holistically when navigating their children's health. I specialize in colic, eczema, reflux, food allergies, food intolerances, food sensitivities, CMPA, cow's milk protein allergy, MSPI, milk and soy protein intolerance, FPIAP, food protein-induced allergic procticulitis, and FPIES, food protein-induced enterocolitis syndrome. And I subspecialize in the moms breastfeeding these little ones. Now, who is this workshop for? I want to make sure that you know that you're in the right place. So this is for you if you are a breastfeeding mom or a mom who previously breastfed. And this is for you if your little one has colic or had colic, reflux, eczema, food allergies, intolerances, sensitivities, or was diagnosed with one of the conditions. And this is also for you if you're a mom who isn't sure what or if their baby has a condition. So this is for you as well. And this is also for you if you are a mom who has heard about eliminating diets from your food. Hi, Tara, good to see you. So it's also for you if you have heard about maybe possibly needing to eliminate foods from your diet and you aren't sure if you need to. And it's also for you if you have been eliminating foods from your diet as well. So this is for all of the above. Now, this is especially for you if you are a mom who wants to really transform your daily experience from one that may be stressful, anxiety-provoking, and overwhelming to one where you can feel calm, confident, and empowered. And this is for moms who want to find peace in their souls, who want to learn how to connect and trust their hearts as they navigate this journey, whether it's health challenges of their own or with their little ones. So the objectives for today's workshop is we're going to go through a number of things. It's jam-packed with information for you. The first part, we're going to go through what really does it mean, a holistic and integrative approach. And then we're going to think about what you've already tried, how this approach is different using those holistic and integrative components. And then we're going to dive deep into those 3 components. So the 3 components are customization, mind-body connection, we're going to go really in depth there, and then the mom and baby connection. And then there are plenty of resources that I have for you as well. So let's go ahead and get started with what is a holistic approach? What does that mean? And so have you heard of the term holistic before? And I just want you to take a moment to think of what does that mean to you? From my perspective, a holistic approach is a solution that addresses the whole person. So we're looking at physical, mental, emotional, energetic, and spiritual aspects. And all of these aspects are interlocked and need to be addressed together, not in isolation, so that there can be resolution of signs and symptoms and healing. And some examples of this are diet, gut health, genetics, mindset, toxicity, and lifestyle factors. And essentially all of these factors work together. So a lot of the time when we think of, if you think of like a 3-legged stool, if you are only looking at one aspect, so let's say you're looking at nutrition, but you're not looking at the other aspects, that stool is still going to be wobbly. There's not going to be that healing, that change that you're looking for. And this is oftentimes what happens when moms, let's say they do go down the elimination diet route. They have focused a lot of their attention on eliminating foods, but they aren't paying attention to the other factors, and then they're not seeing improvement, they're not seeing change. So what is an integrative approach? And I'm, again, curious if you've heard of this terminology before. For myself, it means a solution that integrates and combines aspects and techniques from different therapeutic orientations, different modalities, which are best suited for the client's particular problem. So there is a combination here, right? Conventional medicine. So that is something that I am trained in as a doctor of physical therapy. I have my degree in healthcare background, and that includes things like regular medicine when we're looking at allergies, like an allergist, the pediatrician. Those kind of providers are more along the lines of conventional medicine. Now, as a doctor of physical therapy in the US, we have direct access which means that we are direct access providers. So you can walk off of the street into a physical therapy office and see a physical therapist that day without a referral, because we are trained in screening with ruling in and out certain conditions. So we have that background, almost like a primary care provider would. Now, where this is different is that I also integrate nutrition. I do have a degree in nutrition as well, gut health, something called EFT or emotional freedom technique, emotion code, energy medicine, medical intuition, divine muscle testing, mindfulness, meditation, self-care, energy work, and energy healing. Now, this is what is so different and makes it so powerful, because when we approach it from all of these different aspects, that three-legged stool, we are taking care of all three of those legs. And that way we can get the stool to stand evenly. Now, the key is with this integrative health approach, that middle part on the bottom diagram there, right? That is the sweet spot. When we take what we can from the conventional medicine approach, we take what we can from complementary and alternative medicines, sometimes these are called Eastern medicines, and then self-care. Because you as the mom in this situation, it is equally important that you are looking at yourself in relation to your baby's health challenges, to whatever challenges you're experiencing in motherhood. You matter. You are an equal and important piece of the puzzle. So when we get all of those together, that sweet spot in the middle is when transformation happens. That is when your life changes, when there's more joy, more happiness, more health, more excitement, and more liveliness. So this is what I love doing. I love helping walk moms through this process. So I want to now talk about the impact in health over a lifetime, because you are here today. And just by being here, you are going to change the trajectory of not only your life and your baby's life, but generations to come. So when we look at the graph here at the bottom, this is time. So we're looking at the baby age, right? Baby stage to 5 years old, like my daughter is, to exponentially when they're 30, 40 years old, to even when they're 90 years old. This information is going to serve them throughout that lifetime. And I want you to take notes. I want you to ask questions. I want you to be curious and have an open mind. And if there's something that isn't making sense, please feel free to, you can raise your hand on Zoom, and I'm happy to answer questions as well. And there will be a Q&A at the end. So when we look at this exponentially, by you being here, taking notes, asking those questions, getting this information, you set your baby up for a lifetime of health. Because when we can teach our little ones what good nutrition is, how to eat nourishing foods, and when we look at their emotional and energetic health, when we parent them in a holistic fashion, we are essentially setting them up for a lifetime of success. And now when they're 5 years old and they're entering school, they're going to be calm, they're going to be empowered, they're going to feel confident in themselves in these new situations. And then when they're, let's say 30, 40 years old and they have kids of their own, now they are helping the next generation learn these same things. And same thing applies when they're 90 years old and maybe their grandparents and great grandparents, and they can help give this information down through the generations. So really, this is so impactful. And it's something that's so important for me to mention, because you're not just here for the breastfeeding term. This is something that's going to help their health through a lifetime. And again, your generations to come. So before we get into the meat and potatoes to say, I want to do a quick moment just to take a self-assessment. So you can rate yourself from 0 to 10. And we are going to, I just want you to pick whatever number comes first to you, kind of from your gut. So you can, if you have a piece of paper or on your phone, you can just label A, B, C, and D. There's just 4 of them. And the first one is, how confident and empowered do you feel going through this experience? So 0 to 10, 0 is you're not confident, you don't feel empowered as you're going through this journey. 10 is that you feel very confident. The next one is, how calm and sure do you feel with your next steps? 0 is you're not calm, you don't feel sure, you don't feel certain at all. 10 is you feel extremely confident, calm, and sure, knowing what your next steps are. C is, how much do you feel that you're trusting your heart going through this process? So that you are in tune with your heart, with your intuition, and you're making decisions from your heart. So same thing, 0 to 10. 0 is that you don't feel in tune with your heart. You feel like you don't trust yourself or you can't make those decisions. 10 is that you feel extremely in tune, that you totally trust your heart. You go with your intuition. And then D is how at peace do you feel on this journey? 0 is that you don't feel at peace at all. You're anxious, you're worried, you are frustrated, overwhelmed. 10 is that you feel extremely at peace. You feel like you have let go. You are in a state of surrender. And again, just whatever comes to you. And hold on to these ratings because we're going to circle back to them at the end. So my next question to you is, what have you already tried? And this is going to be different depending on what your baby is presenting with. So let's say, these may vary. So I'm going to go through them one at a time. So let's say your baby has colic. Maybe you've tried colic drops. Maybe you've tried certain medications. Maybe you've tried belly massages. Maybe you've tried burping extra. Maybe your baby has eczema. So maybe you've tried lotions and creams and steroids. Maybe you have thought that you may have needed to eliminate foods through your diet in order to breastfeed. So maybe you have tried diet changes. Maybe you've tried eliminating certain foods. Maybe you thought there's some people that say once baby starts solids, things improve. So maybe you've tried solids. And also many moms get the information, like I did personally, that, all right, breastfeeding, let's just go to formula. And I'll go into my story a little bit later, but maybe you have tried switching to formula. Now, the thing is, if there are true allergies going on, switching to formula isn't going to take that away. That's not going to make that magically disappear. So overall, if you're here today, you've tried things, but they're not getting you the results that you want. They're not the solutions that you need. Would you agree to that, right? Now, we're going to talk about two different scenarios. This is a scenario I often use because it paints the picture very clearly. So I want you to imagine you're going to the doctor with a headache. And scenario A is the doctor goes, all right, you have a headache, here's a prescription, go ahead, take it. Now, a portion of patients will take that medication and they will feel better. And then another portion of patients will take that medication and they won't feel a difference. Maybe they'll even feel worse. And there's side effects with medication, right? Now, scenario B is that the same thing, you go to the doctor and say, hey, doc, I have a headache. And this doctor does a thorough examination and assessment and evaluation. Based on those findings, a portion of the patients, they say, hey, I want you to get some imaging done. Another portion of the patients, they say, hey, I actually want you to go see a physical therapist because I think your headache pain is coming from your neck. Another portion of patients, the doctor may give them medication. Which do you think is going to have better outcomes? Which do you think is going to have a better resolution of symptoms? I think most of us would agree with scenario B, because what we're doing is we're tailoring the approach to the individual, the patient, the client in front of us. And that's something that I very strongly believe in as an evidence-based practitioner. What that means is we look at the research, we look at the patient, the client standing in front of us, and we also look at our own experiences. When we combine all of those together, we get the best client and patient outcomes. So that is how this is really different. With these holistic and integrative solutions, we identify and address the root cause, the underlying reason. With these thorough evaluations and assessments, we can look at the problem, we can identify it, we can define it, we can understand it, and then we can identify the root cause. We can make a change, a corrective action, and then we monitor the system. And for many of us, we have to go through that cycle, the root cause analysis, multiple times because there usually are multiple underlying root causes. And that's why that integrative approach is so crucial, because if we're only looking at it from one perspective, we may be missing whole other perspectives as well. And it really is a mind, body, and soul approach, because when we are doing something that doesn't align with our heart, it doesn't align with our soul, health challenges can pop up. When we're doing something that emotionally and mentally is not good for us, there's going to be health repercussions with that. And we're going to go way in depth with this with a mind-body connection in just a few minutes. So I just wanted to quickly ask, does that make sense? do you follow kind of the process, the approach, and how things are different here? So before we get into things, I want to introduce you to the reason why we're here. This is my daughter, Claudina. Back in 2017, she was born. She experienced colic eczema reflux, severe food allergies through my breast milk, and we made many mistakes. I have a degree in nutrition. I have all this healthcare background, and there were still pieces missing to the puzzle because I just didn't have the experience. And unfortunately, we went to our pediatrician, we went to specialists, and they just didn't have the answers that we were looking for. They weren't able to identify and address our root causes. And it took us a long time. It took us over a year to identify a huge root cause of hers and get it taken care of. And then it was about 18 months when we finally started turning a corner, when we started putting more pieces of the puzzle together. Now, this was an extremely challenging time. As you can imagine, I was so sleep deprived. I was going on 20 minutes of sleep some nights. My anxiety was going through the roof. I didn't feel good about myself. The one thing that kept me going, there were actually two things, but the main thing that kept me going was my heart and intuition. For whatever reason, I was following that, even though it wasn't in my nature necessarily to do that. But in this situation, when it was my daughter, I was hell-bent on following my intuition. And I'm so happy I did. Now, the other thing that happened during that time, it was about that 18-month mark, was I met a local mom whose daughter was a year older and had the same condition as Claudina. That support, that community and understanding was really, really transformational. I was in a dark place at that time. And my friend, I don't want to say her name right now, but she holds a dear place in my heart because she showed up at the perfect moment and really helped support and motivate me through to keep going, to keep searching for answers, to keep pushing. And that's part of the coaching that I provide as well, because I have gone through this and I understand how challenging it can be. Now today, Claudina is almost 5 years old. We are still breastfeeding. We're still eliminating from our diets. But the big difference is that we're not focusing on the elimination. We're focusing on the abundance. We're focusing on all the nourishing foods we can eat. We are focusing on healing. We are focusing on the energetic aspects, the emotional aspects, the mental aspects, the lifestyle aspects. And that has been transformational. And that is why I'm so passionate about helping other moms through this transformation as well. So as we go through this information, at times it may be a little like much, I will admit to that. So I'm going to try to go slowly and explain things as best I can. So again, this is the time, if there is something, go ahead and just raise your hand. Feel free to ask questions. But getting this transformation for you is something that I want. I want to help you on this journey as well. So let's go ahead and get started with the first key, and that is customization. We need customized and tailored solutions for our individual situations. So when I was going through this in 2017, my pediatrician didn't have great answers for me. The specialists we saw didn't have great answers. So I turned to Facebook groups. I turned to Dr. Google. Now, the problem there is that because we're so individual, there was such a wide range of information out there. One mom said this worked for her. Another mom said that worked for her. This mom tried this, that mom tried that. And in desperation, I tried anything I could, everything and anything. It was like throwing pasta at a wall, hoping something would stick. Now, the challenge with that is we didn't do what we needed to at the right time. We did things way too early. We did things way too late. It was all out of order. So it wasn't comprehensive. It was a mess. And I made my life more stressful because of that. I was more overwhelmed because of it, because I didn't have direction. I didn't know, I didn't have a system. I didn't have a framework. I didn't know the steps to take. Now that is where this root cause analysis comes into play. I highly, highly, highly recommend that you do work with a practitioner. someone that you trust, someone that resonates with you. Even if it's not me, I want you to work with a practitioner, someone who can do this root cause analysis with you, someone who practices holistically, someone who looks at an integrative approach, who can help you really identify these root causes and only give you what you need, only give you the guidance and the advice that you need for the next step that you're taking, not throwing pasta at the wall. So this is, again, where we specialize in. And I'm going to give you one thing that you can work through on your own. So if your child, if your baby that is presenting with colic, reflux, signs of food allergy like vomiting, mucousy or bloody stools, again, food intolerances, food sensitivities, maybe you think they do have CMPA, MSPI, FPIAP, or FPIES, okay? If your child falls into any of those categories, I want you to see an IBCLC. What this is, it is an international board certified lactation consultant. Now, these are specially trained lactation consultants, and I want you to see someone in private practice. And I'm going to share a quick story as to why. So when Claudina was born, in the hospital, I knew I wanted to breastfeed, but I was very worried about it. I was anxious about it. I had friends who didn't have successful breastfeeding journeys, and I was so set on wanting to breastfeed that I wanted as much help and guidance as I could get. So during that hospital stay, the couple days in the hospital, I saw 4 different lactation consultants. I kept calling them and I kept asking about the latch, asking about this, asking about that. Now, what they all told me was that, no, she's latching fine. Pain, what you're feeling is normal. And no, don't worry about it. Oh, she may have a little bit of a lip tie. Don't worry about it. So I kept that in the back of my mind. I had that in the back of my head for a very, very long time, for over a year. In our situation, we had signs and symptoms that weren't getting better, no matter the foods that I eliminated, no matter what changes to my diet I made. And it wasn't making sense. And I just kept thinking, I saw things about oral ties and heavy letdowns and oversupply, but I just kept thinking, no, the lactation consultants told me it was fine. It's not her latch. It's not this. It's not that. Finally, my intuition about that kicked in. And after a year, I finally said, no, I need to go see someone. So we finally did. We saw a local IBCLC. Automatically, she said, yep, there's some flags here. Things aren't ideal. She recommended that we see a preferred provider. We went and saw them. Then I had a procedure for her ties that day. And all of a sudden, certain signs and symptoms that just wouldn't change were gone, because we finally identified and addressed the root cause. Can you see how powerful this is? I was killing myself not eating this and that and that and the other when it was a structural issue. It was a physical issue the whole time, but I totally missed it. So I highly encourage you to look for someone. Now, there are multiple things that can create these signs and symptoms that you're seeing, like the colic, the reflux, the signs and symptoms of food allergies. So it can be, I mentioned some of them, the oversupply, the ties, the heavy letdowns, etc. And IBCLC lactation consultant is the person to help you. Now, all IBCLCs are not the same. So if you go to someone and you feel like you're not being heard, you feel like they're not really listening to you, you feel like they're not helping you, I give you permission to go to a different one. I give you permission to keep looking for answers until you find it. This is the empowerment piece. I don't want you just to give up. And even though your heart and intuition is screaming at you, I don't want you to ignore that like I did for way too long. Now, what I have done is I've created a IBCLC resource. And that it also includes preferred providers and body work as well, because all 3 of those components need to be taken care of if you do have structural issues or tightness, if you see that in your child as well. So what I have done, I don't have the link here, I have it at the end. So I will send that link as well. I'll put it as a separate part in the course. And what I want you to do is go ahead and download it, open it up, and get that support that you need. Okay, I highly recommend that you do that. And if you do find that you do need lactation support, then I highly recommend going forward, following their plan of care, getting the body work if you need to, getting to a preferred provider if you need to, because that can be a huge piece of the puzzle that may be missing for you, like it was for us, and you may not even know it. So the next thing, oh, I think, hello, Mira, I see you coming on. Would you be able to mute yourself if that's okay? Thank you. All right, awesome. And then you can unmute yourself if you have questions. There's a little feature in Zoom where you can raise your hand as well. So then I'll be able to get your question as well. Now, this is where the customization takes place, right? So this is where you want a provider working with you, where you want someone's assessment and evaluation, someone who is skilled in this, someone who has worked with other families in this. Now, there is a little bit of customization that you can do, and I want you to empower you to make the decision that you can. And this is the one piece. So if your child only has eczema, if they only have eczema, only skin conditions, and you have no other symptoms, so no colic, no pain, no painful breastfeeding, your baby's gaining weight well, they're pooping every day or every 2 days, they're not spitting up, they're not vomiting, they have no other complaints, they're a happy, content baby, and they only have eczema, then you don't need to see a lactation consultant. Okay, that is the key differentiating factor there. So that is something that I want you to have. I want you to have that information. And if you have questions about that, if you're not sure, at the end, there'll be some opportunities for us to connect and that I can give you a little guidance if you're not 100% sure and you wanted some guidance on that as well. So this is number one, customization and getting an individualized care plan for you and your little one is absolutely crucial. All right. So, this is where I put the links. So these are the links for the highly recommended providers. So the first one is where you'll find the list. It's international. And also, if you have seen an IBCLC that you loved, that you thought did a wonderful job, please let me know. Reach out and I'll add them on there. I'll connect with them because building relationships with these lactation consultants is so key and crucial for the health and well-being of our little ones. Now, the second link there is a link for the Mindful Moms Circle. So if you are, this is also going to be on YouTube. If you are watching on YouTube and you aren't in our community, please join. It's a free, supportive, and empowering community. And there I have trainings. So I have trainings on how to identify things, how to know if there's something not right with your latch as well. So there are plenty of resources in there. And if you are watching on YouTube, go ahead and register for the workshop. And then I will, in the course itself, I will have links directly to those materials for you as well. So you can access those at any time. All right, so now key number 2, this is the big one, the mind-body connection. Have you heard of this before? Have you heard how your mind, your emotions, your mental state can affect your physical body? So this is a crucial key piece. And it was funny, I was actually doing the slides for this presentation yesterday. And when I got to this, I took a moment, I'm like, this is such a huge topic. How am I going to portray this? How am I going to communicate this in a way that's going to resonate, that moms are going to understand it? And because there's so many pieces to it. So it's really funny because I decided to go for a walk, clear my head, and I decided to listen to an interview. I just randomly chose one. And it happened to be someone called Dr. Naisha Winters. And it was perfect synchronicity. What she does is she studies psychoneuroimmunology. And it is the study of the interaction between the psychological processes and the nervous and immune systems of the human body. So essentially our thoughts, our feelings, our beliefs, our mindset, and the direct effect that it has on our physiology and our physical body. And this includes components like the gut microbiome, the immune system, and the gut-brain axis. So we're going to go in depth in these, but it was wonderful because after listening to that interview, I was like, it was perfect because she teaches the same things that I do. She coaches and treats patients the same way I do. And just hearing her explain it made it so much easier for me to just go and do my slides. And it was just nice and easy and smooth going from there. So now let's go deeper into this because as you can see on this slide, there's a lot there. So when we observe our thoughts and emotions and how they impact our experiences physically, mentally, emotionally, and spiritually. This practice is a powerful ally in our healing journey. And this is paraphrasing Dr. Nisha. So this is a crucial piece. And this is, in my mind, what I call mindfulness and consciousness. This is why it's called the Mindful Moms Circle, our community. And this is really giving your power back. Because when we start to understand that we cannot control our outside circumstances, we cannot control other people, we cannot control or change anyone else's beliefs, etc. But we do have agency over our thoughts, we have agency over our beliefs, our feelings even, and essentially our mindset. And this is where you get your power back. This is where you can stand in your power. And no matter your outside circumstances, you and your mindset can be bulletproof. And this has been huge on my transformational journey personally. And it has absolutely transformed my experience, my daily experience, to now include joy and energy and health and happiness and presence and abundance. When before I was extremely anxious, I was super stressed, so overwhelmed. And this key piece has absolutely transformed my life. And again, it's so passionate. I'm so passionate to help other moms through this transformation as well. And essentially, we talked about that three-legged stool earlier. If you can't heal without working on other components. So again, if you're only looking at nutrition, but you're not looking at the mindset pieces, you're not going to get full healing. You're not going to get full resolution of signs and symptoms. If you are only looking at exercise, for example, right? So as Dr. Nisha said, you can't exercise your way out of a crappy diet, and you can't meditate your way out of a crappy diet either. You have to have all of those components put together, and that is when we can really get change and transformation happening. So let's go into this a little bit more, because again, this is a lot. So how does this affect our body? One component of it is our vagus nerve. And this nerve is for our parasympathetic nervous system. What this means, it's a cranial nerve, and it innervates all of our organs. So what it does is it has an impact on respiration, digestion, our hormones, our lymphatics, and more. When stimulated, when this vagus nerve is stimulated, our body relaxes, and we can go into the state of rest and digest. This is where healing happens. This is where regeneration and repair happens. So if we are not in this parasympathetic nervous system state, if we're in the sympathetic, which is the opposite, and we're going to talk about that in a moment. If we're in the sympathetic nervous system state, we cannot heal. So no matter what we do with diet, no matter what we do with gut health, no matter how much we exercise, no matter, how much other things we do, if we can't get our body into this parasympathetic state, we are not going to heal. And this goes for our little ones as well. So if there's a block to it, the healing process doesn't work well. We can't move forward. Does that make sense? Have you heard of this before? Now, going further, right? When we look at happiness and joy and our experience as moms, really, the only two things that give us happiness are dopamine and serotonin. They are neurotransmitters, and they create those feelings of happiness and calm. Now, the cool thing is, and where another piece of the puzzle comes in, is that 80% of our dopamine and serotonin receptors are in the gut. They're in our digestive system. So if what we eat, what we drink, what we breathe even in, our environment, what we think, our emotions, it affects our physical healing. It affects our emotions. It affects our health. It affects our happiness. So when we look at this, again, if we are only, for example, looking at eliminating foods from our diet when breastfeeding, but we're not addressing gut health and the gut microbiome, we may not see improvement. We may not see resolution and healing happening. Now, when we look at the gut microbiome, some of you may not be familiar with that terminology. What it is there are trillions of bacteria, fungi, and other microbes in our digestive system. We actually have multiple microbiomes. So we have a skin microbiome, an oral microbiome, there's others as well. Now, in our gut microbiome, the key piece is that we feed it every day. We feed it with what we're eating. We feed it with the nutrition that we're providing or malnutrition that we're providing. Are we eating nourishing foods? Are we giving our bodies what they need? Is there something called leaky gut? Are you familiar with that terminology? So leaky gut essentially means where there is disruption between the cells, where there is access so things in our digestive system can get into our bloodstream. And if you do find that eliminating foods from your diet, kicking the desk there, if you find that eliminating foods from your diet does make a difference, then I can almost guarantee that you do have some degree of leaky gut. And we need to heal that leaky gut so that then the molecules of food are not getting into your bloodstream, they're not getting into your breast milk. And this is where we're going to talk more about this, but that mom-baby connection happens because our digestive system directly affects our baby's digestive system in that way. Does that make sense, right? So what we eat, if we have leaky gut, that's going to get into our bloodstream, it's going to get into our breast milk, and therefore it's then going to affect our little one's digestion as well. So we talked about ingesting, key components are ingesting nourishing foods to heal. And gut health is much more than probiotics. So some of you may be taking probiotics, and I personally, we did a healing protocol without probiotics for the first few years. And then now we're doing different kinds of probiotics and probiotic foods. So this is, again, where that individualization and customization comes in. You want a practitioner working with you that will tell you when is the right time to do probiotics, when is it not, when do you want to do this, when do you want to do that. Now, the other key component here is we can be eating nourishing foods. However, is our body able to absorb and utilize them? So there are things that we want to look at, like our digestive enzymes, like our hydrochloric acid, like our vitamin status, the health of our organs. Are they actually able to take that nutrition and actually utilize it? These are all key pieces. Another key piece is histamine and inflammation. Is there a lot of inflammation in the body that's preventing these systems, these processes from working adequately? Now, it was interesting because earlier today, a mom actually asked me about picky eating. And she said, will this work for my daughter? She's breastfed, but she also is really picky with eating. And I said, yes, absolutely. Now, this is an interesting component that I wanted to include today as well. So when we look at this gut microbiome, we can have imbalances in it. Essentially, imbalances of that bacteria, the fungi, and other microbes. So if we have an imbalance, if there's an overgrowth of one of these organisms, they are actually going to change our cravings. They are going to change the way our emotional state is. They have an effect on our emotions and our feelings. So if there is an overgrowth, let's say of yeast, then that is going to create more sugar cravings. That's going to create more carb cravings. And at the same time, that's when we see the picky eating. That's when we see the kids who only want to eat, the French fries. They only want to eat the pasta. They don't want any protein. They don't want any fat. They only want the carbs. More than likely, again, you want an assessment and evaluation, but more than likely there's an overgrowth happening there, and there's an imbalance in that gut microbiome. So when we can identify that and we can address the gut health, which again is way more than probiotics. There are healing protocols. There are ways that we can work through balancing the gut health and the microbiome. When we do that, then the picky eating goes away. And I mean, toddlers are going to be toddlers. I'm going to be very honest. There are still days where even my daughter will not want to eat X, Y, or Z. However, her norm is that she loves the healthy foods. Excuse me. The norm is that she's great. Excuse me. She's great with eating meat and protein and our probiotic foods and XYZ. And that again goes back to that timeline, the impact over generations, because what happens is when we teach our child what these healthy, nourishing foods are at an early age, their taste changes. So they actually have a different affinity for the tastes that they like. We balance that gut microbiome, and then that sets them up for the rest of life. So that sets them up to crave healthier foods. That sets them up for health going forwards. Does that make sense? Have you ever thought of it that way? How important and how crucial it is right now, especially in this early age when they're younger. And I will mention, I have connected with some moms who have older children. So for example, just a few months ago, I connected with a mom who has a 10-year-old, and she's just getting this information now. So her 10-year-old had a lot of food allergies. They were only focusing on elimination, but now at 10 years old, she has learned about this gut health and the microbiome, and she wants to help get these nourishing foods in. Now, I will tell you, she told me that getting a 10-year-old to eat these things is much harder, believe it or not, than a young one. Because again, at 10 years old, that imbalance has been happening for a long time. Those cravings have been there for a long time. There are habits. And quite frankly, a 10-year-old can walk out and, very easily be like, I'm not eating, I'm going to my friend's house and I'm having a burger. So there are so many components to this, but I wanted to include that picky eating piece. And we're going to touch a little bit more on that microbiome when we look at the baby and mom relationship as well. All right, so we're going even further down this mind-body connection now. We're going to talk about the sympathetic nervous system. This is the nervous system that reacts to stressors when you are in a stressful situation or you perceive stress. It's essentially a survival instinct, and it has served us and our species for thousands and thousands of years. Now, where this played a part was when we, again, times of cavemen, right? We were walking through the forest and we heard a rustle in the bushes. We didn't know if there was a bear there. So our instinct, all of a sudden, our sympathetic nervous system kicks on, goes into fight, flight, freeze, or fawn. We're going to stick just with fight or flight for today, just to make things simple, right? So if you think there's a bear in those bushes, your body is now ready to either fight that bear or to run away, because survival is the key piece there. That is what we're wired to do. It's a primitive survival instinct, essentially. So what happens is our blood diverts from our organs. It goes into our hands and our legs, into our extremities. Our parts of our brain shut down. So we're not thinking clearly, we're thinking survival. You may feel your heartbeat racing, you may get sweaty, all of these things happen. And this is a natural, normal response. Now, the key difference is that back in the times of cavemen, that happened once in a while, blue moon, right? Nowadays, in our society, we get an email and we go into fight or flight. We get stuck in traffic and we go into fight or flight. We may, someone may leave a comment on our profile or something, and we might go into fight or flight. What our society nowadays, many of us are living in this fight or flight response. Many of us are living in the sympathetic nervous system state. When we're in this state, our body cannot heal. It cannot repair it, and it cannot regenerate. And this goes for our little ones as well. And again, we're going to go into this a little bit more with the mom and baby connection, but we want to look at these things in our little ones. When our little ones do not feel safe, this is something that I just talked about on the first step to the best sleep workshop. I will include that in the resources as well going forward. But when our babies don't feel safe for whatever reason, they don't feel secure, they may be in the sympathetic nervous system state. They may be sensing it from us. They may be getting it directly through hormones through us. Our babies cannot heal, repair, or regenerate either. I saw Elmira unmuted yourself. Did you have a question? If not, that's okay. All right. If you do, go ahead and just let me know. All right. So we're going to go even deeper to this mind-body connection now. So there is a study called the ACEs study, the Adverse Childhood Events Study. What this is one of the largest investigations of the impact of childhood abuse and neglect on later life health and well-being. Now, what they did, this was done in the 90s, what they did is they took 10 criteria and they polled people on these criteria if they had these events happen in their childhood. If they did, then they followed them. And this was initially done to look at trauma and well-being later in life. And what they did, though, kind of inadvertently, is they saw health considerations change throughout the lifetime as well. So the 10 things that they asked about were childhood physical abuse, childhood sexual abuse, childhood emotional abuse, emotional neglect, physical neglect, a mentally ill, depressed, or suicidal person in the home, a drug addicted or alcoholic family member, witnessing domestic violence against the mother, loss of a parent, death or abandonment, or a parental divorce, and then incarceration of any family member for a crime. So again, they asked, if they had these during their during their childhood. Now, what they found was that the higher ACE scores, people with higher ACE scores, there were negative effects on the immune system, the inflammatory pathways, and emotional intelligence that they could track through for a lifetime. So what this meant is that, and the other thing I want to mention is that many of us have experienced these things. So I want you to know that there's no shame, no judgment, no blame, nothing like that here. Only love and compassion, because many of us have experienced at least one of these things, if not multiple of these things. And this is a component that really no one talks about with health, because these experiences that we had in childhood literally change our physiology. They rewire our brain. So what happens is when we experience these things in childhood, right, our brain changes, our neurotransmitters change, our receptors change, our gut health changes, our gut microbiome changes, our emotional intelligence, so our response versus reaction changes. And this is when you may hear of things like triggers, right? So let's say you did have an experience with, let's say, physical abuse, okay? And now when maybe you play a sport and someone has contact with you, you may go into a very aggressive mode. You were triggered into that. Your reptilian brain gets activated, your primitive brain, and maybe you get very aggressive. And even though someone was just playing basketball and maybe like elbowed you, all of a sudden you want to fight them. Or, what else? There's plenty of different examples. Or maybe you break down crying when something happens. Again, okay, it is a-okay if you are experiencing that. And I want to give you empowerment to know that you have agency over helping to heal those traumas as well. So the other thing I want to mention is that it doesn't have to be these huge events either. So for example, you may have been raised with a lot of criticism. That's something that I was raised with. So maybe you were constantly criticized. You were constantly judged, constantly told that you're not doing this right, you're not doing that right, that you can't do anything right, okay? That as well stays in our body. And so now as an adult, in my early adulthood, before I started putting these pieces together, if someone criticized me, all of a sudden that was a re-triggering process and I reverted to that primitive survival state. And these strategies that we used as children, so there's different ones that we can revert back to. We may try to numb ourselves. So that may be, where addictions happen, or maybe like compulsive eating or smoking, etc. Maybe we try to, what's the word I'm looking for? Some people disassociate, where they have an experience where they're not in their physical body anymore. Maybe some people get aggressive. There are different responses that we have, and they're all unique and individual. And we're going to go into this a little bit further as well. But what they found in this study is that if you had 4 or more ACEs, you had a 10 to 12 times greater risk for IV drug use and attempted suicide. You had a 2 to 3 times greater risk for developing heart disease and cancer, right? Our 2 main killers in America. You had a 32 more likely chance to have learning and behavioral problems. When we look at the school system, there are so many diagnoses of ADHD, dyslexia, etc. 8 out of 10 leading causes of death in the US correlate with this exposure to these 4 or more ACEs. And that's the link at the bottom, if you want to go check out the study, it is really a cornerstone of research in this area, in this psychoneuroimmunology, because it has such a huge impact on our physiology and our immune system as well. So what happens, right, when we have these experiences, when we have these traumas, we may experience feelings of abandonment, not being loved, not being good enough, being inadequate, being afraid to show our true selves. And what many of us were taught is that when we have an uncomfortable feeling, so maybe we feel angry, maybe we feel sad, maybe we do have these feelings of abandonment, etc., we often are taught to suppress them. So have your parents, or in the past, have you been told, oh, don't cry, it's not a big deal. Don't be angry, don't do this, don't do that, don't express yourself. Our society has normalized suppression of our emotions and feelings. Now, there are different ways that we can do this. Sometimes it's toxic positivity, right? So, if you're going through a challenging time, maybe someone goes, oh, try not to think about it, stay positive. Maybe they say, don't worry, be happy. And, to a certain point, their intentions are typically good. However, by not acknowledging your feelings, by not acknowledging what you're going through and giving you space and respect to express those feelings of what you're going through and how challenging it may be, this actually can create something called a trapped emotion. And that goes into the energetics, which we'll get to in a moment. So there's other ways that you can suppress. Again, we talked about this quickly. You can numb yourself, right? Self-medicating, emotional eating, drugs, alcohol, etc. And then also you can become disembodied or ungrounded. So that's where I was saying, where you may have experiences where you're kind of out of your body. You may just feel very frazzled, like you can't think straight, okay? And there's different coping mechanisms, right? So the coping mechanisms that we learned as children are these things. We learned this toxic positivity. We learned how to numb or self-medicate. Maybe it was, I'm just gonna go watch TV because no one wants to play with me, or whatever it may be, right? The thing is that they served us in childhood. They served us because we needed to get through childhood. We needed to have as happy of a childhood as we could have. And at the same time, these coping mechanisms are not beneficial now in adulthood. And they affect our immune system. They affect our health. They affect our gut microbiome now as an adult. And that affects our babies as well. So I hope the pieces of the puzzle are starting to come together for you. I hope it's not too much. Now, there is a little test that, again, Dr. Nasha mentioned, which I love. And these are questions that I often ask in the group and other moms. And sometimes many moms don't know the answer to these. And this is a sign that you are suppressing. You are still using these maladaptive coping mechanisms. So if I asked you, right, what brings you joy? Can you answer that? And not like sitting down, like writing an essay, just like from your heart, what brings you joy? What are you grateful for? What are you grateful for in this moment? What is your purpose in life? What is your soul here to do? If you don't have an answer that just jumps out at you, if you really need to sit there and think about these things, then you are suppressing to a certain point. You are suppressing your emotions, your feelings. Because when we are in tune with our intuition, in tune with our heart, these things are top of mind. These are driving our daily experiences. They're driving our daily actions. They're driving our emotions, our feelings. And again, I mentioned that when we are suppressing, we're suppressing our immune system. And that is when we get these health conditions popping up. That is when the microbiome starts to go awry. That is when, again, we can pass it down to our children as well. So this may be a lot. What I don't want you to do is I don't want you to feel overwhelmed. I want you to feel empowered that I'm now going to show you some strategies that you can use to get back on track. And mindfulness is one. So we just did a quick mindfulness exercise here, right? With those 3 questions. What brings you joy? What are you grateful for? What is your purpose in life? I invite you to, after this workshop, write down those questions. Take a few moments and journal around them. If you don't have answers that are just coming up for you, it's okay. And if you feel called to do this work now, I invite you to take some time and just see what comes up for you. Oftentimes journaling, when we are literally putting pen to paper, our subconscious can come forward. And there may be things that you never even knew were under there. They may start coming forth. And when that starts activating, when you start activating your intuition, you start activating your higher self, we get a deeper knowing, we get a deeper knowledge, a higher power that comes into play. And then this is a crucial piece of healing. So I encourage you to do this activity and see what comes up for you. If you feel comfortable to, I encourage you to post it in the Mindful Moms Facebook group, if you feel comfortable to share some of these things. And I've found the more I share these things as I come across them, because I didn't know them at the beginning either. I had to do a lot of work to kind of get these things out of my soul, out of my subconscious. Now that I'm aware of them and mindful of them, I get so excited when I share these over and over again, and I get more and more clarity. So I really highly encourage you to do as well. Now, the next thing we're going to talk about is the energetic body. Now, this falls into that alternative medicine, Eastern medicine. And what this is really looking at our bodies multifaceted. So we've been talking about the biochemical components, the physical components, right? Gut microbiome, nervous system. And what it comes down to is that really our body is electrical and vibrational in nature. Is this a new kind of topic or way of looking at things for you? There are some people who have known about this, and then this may be completely new for some of you. But even conventional medicine acknowledges this. So when we look at an EEG, where they have probes on your head, or an EKG, where they have probes on your heart, what they're doing is they're literally measuring the electric activity of your brain and of your heart. These are electrical fields that can be measured. There are changes that can be measured and seen and used for diagnostic purposes. Now, quantum physics shows that when we look at our hand, for example, right, we have our hand and then we have our skin, and we look at one skin cell. And then if we were to look into that skin cell, there are molecules and atoms. And when we look into these atoms, really, they are vibrational frequency, vibrating so quickly that they perceive to be solid. And so really, if you took a microscope of our hand and zoomed way in, you would actually find atoms vibrating in space with a lot of empty space around them. So what that means is that we are frequency. We are vibrational electrical beings. We are light beings. And based on this, when we look at Eastern medicine, alternative medicine, that is what the meridians are. These are pathways, flows of energy through our body. We look at chakras. These are the colorful centers in the picture there. They are energetic centers. And essentially, because we are vibrational, because we are electrical in nature, our electric fields, our energetic fields affect everyone around us. And we are all connected. So our little ones, anyone that we are especially in proximity to, our energetic field is affecting their energetic field. And our emotions affect our energetic field. Our physical health affects our energetic field. Our immune system affects our energetic field, and vice versa. So this is another key component to the puzzle. When we recognize that we are energy, when we are vibration, again, we can use different modalities. We can identify and address different root causes with some of those modalities that I mentioned earlier, the EFT, the emotion code, the energy medicine. And there's a spiritual component as well. So I alluded to this earlier. When our soul feels that something is not aligned, that maybe we're in a job that we hate. Have you ever felt that, where you're in a job and you feel like your soul is dying on the inside? You won't be performing as well. You may not be doing XYZ as well. You may not be succeeding because it's not aligned. Our soul is telling us this. And at the same time, often when we are, let's say, in that job that is killing our soul solely, that is when the health conditions come in. That is when our health deteriorates. So again, another key crucial piece to the puzzle. We need to address these energetics. We need to address these emotional components as well. And often, very often, they are a key piece to healing. And because we have such close proximity to our little ones, they get that energy from us. So an example of this is when there is a child who is colic. More times than not, I will put money on this, that the mom is anxious. She is worried about being a good mom. She is anxious that she is not doing something right. And there's nothing wrong with that. That's okay. And by being mindful of that anxiety and by making the choice to stand into our power, this was me. So by making the choice to stand in my power and to take back my control and my agency over my thoughts and feelings, I was able to transform that anxiety into health and happiness and energy. So that's just one example, but it has such a profound impact on our health and our little ones. So I want to give you, again, a strategy, something that you can do right now. And we're going to talk about trapped emotions. So on the right here is one of my mentors, Donna Eden. She is in her 70s. And if you ever see this woman on video or, giving a course, she has so much life and energy to her. And I have to say, once I started doing her energy medicine techniques, practicing them and teaching them, I have felt joy in myself that I have not felt before. And essentially what she particularly works with are the meridians. So a lot of energy work with meridians. But I wanted to talk about different perspectives as well. So we talked about suppressing emotions, where we are not fully expressing ourselves, where we are not fully expressing our emotions, our feelings, right? Maybe we were told not to be angry as children. And now every time we get angry, we just shut it down and we put on a smile and we go, no, I'm okay, right? That is not healthy. What happens in that moment is that an emotion gets trapped in our body. So in our energetic body, an emotion becomes trapped. In Chinese medicine, this may be called stagnation, where we have a block or a stagnate. There's someone called Professor Bessel van der Kolk, one of my other mentors, and he wrote the book, The Body Keeps the Score. So when we have these traumas, these emotional experiences, our body holds on to that, and especially in childhood. So when we are in childhood, we may not have the capacity to deal with some of these sometimes very traumatic events that have happened to us. We may not have the capacity to deal with the physical abuse, the sexual abuse, the fighting, etc., that was around us. So what our body does as a child is it shuts down and it stores that emotion. Now that emotion can come back in adulthood and present as a health condition. Now, not acknowledging and being with our emotions, even now in adulthood, we can still trap emotions right now. So maybe yesterday, someone said something and you just kind of didn't express yourself and you just pushed it down. You may have trapped an emotion just yesterday. And so again, this is where the mindfulness piece is so crucial and it's such a key component in the coaching that I provide, because it is transformational once you start becoming aware and you start really allowing yourself to express yourself. It is such a freeing, wonderful feeling. So I lost my train of thought there, but I do want to show you a technique. So there's something called the triple warmer smoothie, and this is a technique from Donna Eden. And what this is a energy medicine, a meridian technique. And the triple warmer is one of those meridians. It's one of the flows of energy when we are in a stressed state. So when we are stressed, when that sympathetic nervous system kicks on, the triple warmer gets flooded with energy. What we want to do is we actually want to deactivate that triple warmer. We want to take the energy out of it. We want to get into a calm, peaceful state. So this is something that I use. You can do it anywhere. You can use it anytime. It literally takes a few seconds, and I use it all the time. So when I notice, when I'm mindful that I'm getting anxious, when I am mindful that maybe I'm starting to go into overwhelm or starting to become stressed, I use this technique. So what I'm going to do is I'm going to demonstrate it for you first, and then I'll have you do it with me. So I'm going to take off my glasses. And what we're going to do is first, I'm going to have you close your eyes. You're going to cover your hands over your eyes. And we're going to have you take a deep breath, a mindful breath. And what that is breathing in through the nose into the belly. And then on the exhale, you're going to drag your hands across your eyes to the temples. And then again, we're going to breathe in through the nose into the belly, staying at the temples. And now on the exhale, you're going to drag your hand over the top of your ear. Right above your ear is an acupressure point, and we're going to stay there on that exhale. Now we're going to breathe in again. And on the exhale, we're going to drag down over our neck to the top of our shoulders. And then again on the inhale. Now on the exhale, we're going to drag down over our heart. So in order to do this technique, this exercise, I invite you to try it. I invite you to close your eyes just for a moment and take a mindful breath. So breathing in through the nose into the belly and out through the mouth. And just scan your body. What do you feel in your body? Are there any places of tension? Do you experience pain anywhere? How is your heart rate? Is it beating fast? Is it beating slow? And there's no judgment to this, just kind of being aware, being mindful of what you're feeling in your body. And once you've got that, go ahead. I invite you to try this technique with me. So you're going to go ahead and close your eyes. You're going to cover your eyes with your hands. I'm going to have you go ahead and take a breath in through the nose into the belly. And now on the exhale, drag your hands over your eyes to the temples. Again, a breath in through the nose into the belly. And now on the exhale, dragging up over the ears to this point right above the top of your ear, an acupressure point. Another mindful breath in through the nose. On the exhale, dragging around your ears, down your neck, over your shoulders. Another mindful breath. And on the exhale, dragging down across your heart. And you can just take an extra mindful breath here at your heart. And now keeping those eyes closed, just scan your body again. How do you feel? Myself, I just feel like a notch calmer, just more at peace. So I encourage you to try this technique whenever you need it. Whenever you feel yourself going into stress, whenever you feel going into overwhelm, whenever you feel anxiety kicking on, go ahead and give it a try. As you can see, you can't hurt anything. You're not going to do anything wrong if you miss a step or anything like that. You're not going to, it's not invasive at all. So you're not going to have any negative effect from it. But I encourage you, try that triple warmer smoothie and see if you can feel the difference. I absolutely do. And I know many others do as well. And so we talked about how our energy affects those around us, including our little ones, including especially because they're in such close proximity. But this also goes for our family members, our maybe partners, our parents, anyone we have a relationship with, and even people we don't have a relationship with. When we just walk into a room, our energetic field is interacting with all the energetic fields of those others, even if you just walk into, a store or something like that. So this is the transition now to key number 3, which is the mom and baby connection. So there's multiple ways that mom and baby are connected, and we've actually alluded to a lot of them already, but we're just going to go through them step by step now. So the first one I want to talk about is the maternal instinct. Did you feel that when you became pregnant, all of a sudden you started thinking differently? or you started acting differently. And especially when your baby was here, did you all of a sudden have this feeling where your heart just opened and you knew that you were going to do whatever you needed to for this little baby? Have you had that experience? And this can come up in different ways. It's something that I talk about in that First Step to the Best Sleep workshop as well, where maybe, we leave our baby in the crib and they're crying, and our instinct is telling us, go get the baby. Don't let them cry, right? Have you ever heard that? That's your heart, that's your intuition speaking. For my example with the breastfeeding, my intuition was telling me, no, keep fighting, keep looking for answers, keep breastfeeding. There's also an emotional component. So again, I talk about this quickly with colic, right? If mom is anxious, if she's worried about being a good mom, if she's worried that she's doing things wrong, baby is going to pick up on that emotional field. And baby may present with colic because they are taking on mom's anxiety, just emotionally. And, even think about the fact that if you are at a place and there's people fighting next to you, right? You feel that energy. It doesn't feel good. You don't want to be near people fighting. Versus if you walk into a party and there's people like dancing and having a great time, that is a different emotional energy. You kind of want to be there, right? If that's where your state is at the moment. So that's how the emotional component comes into play as well. And what's interesting is that each condition has a different underlying emotion associated with it. And again, there's many underlying reasons and root causes to that as well. Now, generational is super important as well, because what happens is that we were raised a certain way. Our parents did the best they could most of the time, and they raised us a certain way. And we learned from that generation how to respond or react to things. So, for example, myself, again, I was told not to cry often. So there's an instinct in me generationally that when my daughter would start crying, there was a part of me that wanted to say the same thing to her. My intuition kicked in at a moment, at a time where I was able to learn different skills, different parenting skills. And I was able to stop that generational trauma, in a sense, from passing on to my daughter. So the reason why our parents taught us that is because their parents taught us that. And their parents taught us that, et cetera, et cetera. So again, this is the power that by learning these strategies, by becoming mindful, by becoming aware, we can stop these generational traumas from passing on to our children and for future generations. And like we talked about, it's all related to health. So if there's less trauma during childhood, our children are going to be happier for the rest of their lives. They're going to be healthier for the rest of their lives. And this generational component is one, again, for myself personally, was crucial. It was such a key piece in putting into the puzzle. And then again, we talked about the energetics, our emotional and actually energetic field, just our energies, how they're flowing, our emotional, I keep saying emotional, our energetic centers. Are they activated, right? That affects the joy, the energy, the confidence that our children experience. And I can 100% say this with my daughter. She's almost 5. She is a bright light. She is so full of energy. She is so happy. You can feel the joy pouring out of her. And it makes me so happy that I was able to incorporate these practices and help raise her in a healthy way. So I know that for the rest of her life, she's not going to think there's something wrong with her. She's not going to think that she's doing all of these things wrong. She's going to be able to she's not going to suppress her emotions and feelings. She is going to be able to fully express herself, no matter what anyone else thinks. Does that make your heart happy too? I don't know, it may just be me, but to me, that makes the biggest difference. So now, especially with the breastfeeding component. There are additional connections that we literally have with our children. So directly through breast milk, we talked about hormones, right? So when we are feeling anxiety, we have an increase of cortisol being secreted in our body. Directly through breast milk, those hormones are given to baby. So again, if we're anxious, emotionally, energetically, hormonally, we are giving cortisol directly to our body, to our baby, which makes them more colicky, more anxious, cry more. Does that make sense, that connection there? We talked about leaky gut. If we have leaky gut as moms and we're breastfeeding, and these molecules of food are getting into our bloodstream, they're activating our immune system, they're getting into our breast milk. Now our baby is getting, again, these food molecules plus immune factors in our breast milk, possibly related to some of the signs and symptoms that you're seeing, right? Microbes. So our gut health, mom's gut health, gets passed down to baby, one, through delivery. So especially if it was a vaginal delivery, baby gets a whole lot of beneficial microbes. And actually, I shouldn't even say beneficial. They are the microbes that mom has get passed down to baby through a vaginal delivery, to a lower extent with C-section. But that is then breastfeeding, you're passing on your gut microbiome to your baby through your breast milk as well. And then the immune system. So when we are, again, breastfeeding, there are immune factors that get passed down through baby. And something that I don't talk about on this workshop, but I have a video that I'm going to link as well, is the immune system, right? So when our baby does have food allergies, or, CMPA, MSPI, FPIAP, FPIES, it means their immune system is hyperactive. Right? Their immune system is on the alert. It's on the lookout. It's fight or flight, right? It's fight or flight. That neurological, that psychological piece has affected the immune system. And typically, not always, but typically it starts with mom, and then that is passed down through baby. And again, I'm not saying this to overwhelm you. I'm saying this to empower you that there's something that you can do about it, that you can heal together. So we talked about the gut microbiome. We talked about cortisol. And I want to give you, again, another strategy that you can use, especially when you're breastfeeding. So we don't want to inundate our babies with cortisol. That's going to make them more anxious. That's going to make them more afraid. That's going to make them more colicky, cry more. So one thing that we can do is we can regulate our own nervous system as the breastfeeding mom, and even not as a breastfeeding mom. This applies to everyone really, right? But when we regulate our nervous system, our baby feels that. And we can think clearer to now help our child learn how to regulate their own nervous system as well. So one of my favorite strategies for this is the mindful breath. And what I invite you to do is, again, close your eyes if you can. I like putting my hands over my heart. And we're just going to walk through this quickly. So on the inhale, you're going to breathe in through the nose, and I really want you to feel your belly expanding on the inhale. And we're going to do this for about a count of 4. So go ahead and breathe in. And on the exhale, you're going to blow out through an open mouth. And the exhale is long. It's about a count of 8, more or less. If you can't quite make it to 8, that's okay. You can do as long as you can. And as you practice and as you do this, you'll be able to go longer and longer. So let's go ahead and do 3 more mindful breaths, breathing in through the nose, into the belly. Nice long exhale through the mouth. Again, in through the nose. Nice long exhale. And again, in through the nose. And a nice long exhale. Now just feel into your body. How does it feel? For myself, it feels really good. I feel calmer. I feel more centered and grounded. And again, this strategy is something that literally takes seconds to do. Now, we go deeper in this during coaching. However, this basic one, Use it all the time. Anytime, you can even start your breastfeeding session with this. If you're getting ready to breastfeed, go ahead, latch your baby and take a couple mindful breaths. You are going to literally change your physiology by doing this, because what you're doing is you're stimulating that vagus nerve that we talked about at the beginning. When you stimulate that vagus nerve, you change your respiration, you change your hormones, you change your immune system. So the more that you can stay in that parasympathetic state, that's what we're switching over to, the healthier your body's going to be. The more you'll be in rest and digest, the more you'll be able to regenerate and repair. And you can teach this to your children as well. So not the really little babies, but, toddler age is when I started teaching my daughter this. And it's a wonderful, wonderful skill for them to learn and then have for the rest of their lives as well. So I have a resource, which is a cheat sheet. It tells you all the steps of the mindful breath. So again, I'll include that in the resources as well. All right, so we went through a lot of material, but especially because we ended on that mindful breath, we're now going to do a quick self-assessment again. So you're going to rate yourself again from 0 to 10, just first number that comes to your mind. How confident and empowered do you feel going through this experience now? 0 is not confident or empowered at all. 10 is extremely. How calm and sure, how certain do you feel with your next steps? 0 is you don't know what you're going to do next. 10 is you know exactly what you're going to do. How much do you feel that you're trusting your heart through this process? 0 is you're not trusting your heart at all. 10 is you're totally trusting your heart and intuition. And how at peace do you feel on this journey? 0 is you don't feel at peace at all. 10 is that you feel completely at peace and surrender. And these numbers are just for you. If you'd like to, you can always share them in the Facebook group, because I love seeing that change, that shift that happens by being present here. Again, by taking notes, asking questions, even if they don't come up now, you can ask them later. You are literally going through a mini healing process. This awareness is an energetic healing. It's an emotional healing, and it's going to affect your physiology and your baby's physiology as well. So just a quick recap, right? The 3 key components that I want you to take away from this workshop is customization. You need to have someone guiding you through a customized and individualized, tailored, specific to you solution. Whether it's myself or a different practitioner, I want you to find someone who specializes in this area and who uses a holistic and integrative approach. The second component is that mind-body connection. Our mind, our thoughts, our feelings, our beliefs have the power to change our physiology and our physical body. Number 3 is the mind-baby connection, mom-baby connection. So what we are feeling as moms, our emotions, our energetic state, our physical body, our hormones, directly affects baby as well. And it really is a relationship. So when there is a child that, we're working with, the mom is equally as important to go through the process of healing as well. Now, we've gone through a lot. We have talked about so many important topics. You've gotten some really great strategies. There is so much more to it, though. There are things that we haven't really gotten around to because of time. I'm already going over an hour, but I'm okay with that. There's so much more to it. There is the genetic component, right? Genetics play a key piece in it. Now, the key is epigenetics shows that we have agency over changing our genetic expression. So just because you may have a certain gene or a gene mutation or a gene SNP does not mean that you are fated for disaster, right? Because our ability to change our emotional states, our energetic states, our mental states, has that ability to change the expression and activation of our genes. That is the study of epigenetics. There are lifestyle factors, environmental factors, toxin factors. So these are all things that we haven't gotten to and that are included in coaching. Now, ultimately, we all want our little ones to be happy and healthy, right? That's what we're here for today. And I also give you permission to prioritize yourself, Mom. You also deserve and you are worthy of being happy and healthy. You're worthy and able to have boundless energy. You are able to be joyful, full of joy. You have the ability to be present in the moment, to feel abundant, and for both you and baby to heal together. That is the transformation that I help my clients with. I help literally transform your life using this approach, this holistic and integrative approach. Now, some of you may want to try this on your own, and I have resources available for you. And others of you want the guidance. You don't want to wait any longer, because as we know, this has an exponential effect, right? Why waste another day? Why go through another sleepless night if you can get improvement, if you can get healing, if you can get repair and regeneration now? So for those moms who are dedicated, who are motivated and committed, who are ready to make this change in their life, who are ready to transform their lives, right now, I have openings, 3 spots for one-on-one coaching. And what this is a number of sessions. I encourage you, if you are interested in this, go ahead and book a guidance call. Because you're on this workshop, I have 100% off code. It's 3 keys. It's right on the slide there, but I'll also send it and include it in the resources. It's good until September 7th. Go ahead and book a guidance call. And what we're going to do is we're going to sit down. We're going to hash out what are your challenges? How much help do you really need? And then we can create a custom package for you. And again, I've only got 3 spots for this right now. And there's going to be really special pricing for the first mom to sign up. It's going to be 50% off, which is phenomenal. You're going to get a great deal because I really want to serve. I really want to help you get this transformation. I want to help you change your life. I want you to feel this happiness and joy and energy that I feel. And I know you can feel as well. You just need to say yes to yourself and to your baby at this point. So again, those 3 spots are open. They're first come, first serve. And the moms who may not be quite ready for this right now, I am opening up the Mindful Moms Circle, which is empowerment coaching for moms. And it includes this healing system. This is going to be community coaching. So group coaching, and it's small group coaching. Where, again, you have access to me and I am there to cheer you on. I am there to keep you accountable. I'm there to support you. I'm there to answer your questions. I'm there to get you the resources that you need. I am there to hold your hand through the process and empower you to take agency over these things, over your thoughts, over your beliefs, over your feelings, and literally transform your life. Now, this is going to be opening up in the next few weeks. So if you're interested in that, but you're not ready for like the one-on-one coaching right now, I encourage you, again, book that guidance call. It's free for everyone who attends this workshop. You get the code. And on that guidance call, we'll, again, be able to go through and see which package is going to be best for you. Are you ready to start right now? Do you want to wait for the community coaching? And then there's also a VIP upgrade with that. If you feel that you need the practitioner side of things, where you really need the healing protocols, the gut health, and again, really specializing more into that individualized care for the colic, eczema, reflux, food allergies, intolerances, sensitivities, etc., then the VIP upgrade is an option as well. So that includes more of nutrition plans, gut health protocols, etc. So that's more of the medical side of things. Now, there are some of you who don't really want to do that. You don't want to do a group coaching program. You don't want to do one-on-one coaching, but maybe you just need some help getting guidance. So for you, I have the Jumpstart to a happy and healthy breastfed baby. And what I've done is I've discounted the price again until September 7th. So this is just available on my website. The price is discounted. And what this is a self-paced course, and it helps you start ruling in and out certain root causes. So we focus a lot on diet and nutrition and the lactation piece. So if this is something that you feel like you need help around, you want help around, but you don't want to do the group coaching, you don't want to do the one-on-one, this is a great option for you. This is self-paced, so you go at your own speed. This is, you have lifetime access. and you can, there are quizzes as well built in. It's interactive. So you're making sure that you're getting the information, that you're learning the things. It is really powerful because it teaches you how to start thinking like a practitioner and how to start evaluating and assessing on your own as a parent. So this is super, super valuable. And you also get a free guidance call included with that. So after you go through the program, then we meet and I give you individualized and customized guidance based on what you've already learned with that assessment and evaluation. So those are wonderful, wonderful resources for you. And again, I will send those links afterwards. And there are lots of other ways. I've written a book called Breastfeeding Bliss, how I went from anxious, sleepless nights to calm, confident, and empowered. And this book is available on Amazon. There's an ebook and there's a paperback, or you can get a signed copy on the website. And this is just our raw and authentic story. If you are a breastfeeding mom, if you have gone through the elimination diet, or have tried dairy-free or something like that, you will feel validated, you will feel heard, you will likely be crying through it, which is okay, because that is a way that you are not suppressing your emotions, you're acknowledging them. And it's a really healing process. It's interactive as well. So it has mindfulness activities in there for you. It has ways of stimulating that vagus nerve for you. It has resources for you as well. So really, really important, and it's a short read, so you can do it in a nap or two. So I highly encourage that. And if you don't want to do that, just join our community. There's so many resources on there. I'm also on YouTube, Dr. Beata Holistic Health Coaching, and I have so many trainings and videos there to support you on your journey as well. I want you to get the support that you need, get the information that you need, and not stop. Don't stop listening to your heart until you know that you've gotten the answers that feel good to you. Okay, that's something I wish for you.